Do you need a measles vaccine before traveling? Well, if you're going to places like Africa, Asia, Latin America, or parts of Europe, even Texas, you may need more than just a plane ticket. Today, we're talking about measles, a highly contagious virus that still causes outbreaks around the world, and why getting vaccinated before travel is one of the most important steps you can take to protect yourself and your loved ones. We're also going to discuss traveling with infants and who should get a measles vaccine before a trip. Hi, I'm Dr. Lavanya, a pediatrician and travel medicine specialist, and you're watching the Park Pediatrics and Park Travel Clinic channel. If you want to stay in the loop with the latest expert pediatric and travel medicine information, please make sure to hit the like and subscribe button below. Just a quick note, everything I'm about to share with you in this video is based on the most current public health information available as of June 12th, 2025. Measles outbreaks and travel recommendations can change, so it's always best to talk to your child's pediatrician or your own healthcare provider for guidance that's specific to your family and your travel plans. So let's start. What is measles? Measles is caused by a virus that spreads through the air when an infected person coughs or sneezes. It can stay in the air for up to 2 hours, meaning you could catch it just by walking through a room where someone with measles had been. The symptoms usually start with high fever, cough, runny nose, very red, watery eyes, and then a few days later, a rash that spreads all over the body. Measles isn't just uncomfortable, it can be very dangerous, especially for babies and people with weak immune systems. It can cause ear infections, pneumonia, brain swelling, and even death. So why worry about measles now when traveling? Measles is just not something of the past. It's an issue right now within the US and globally because cases are rising. According to the World Health Organization, there were over 300,000 cases worldwide in 2024, with outbreaks reported in over 100 countries. And it was even in places you might not expect, like France, the UK, Japan, and Israel. In the US alone, in 2025, there have been reported 1,168 confirmed measles cases across 34 states. This is the highest levels in 30 years. Outbreak clusters are mainly in Texas, New Mexico, and Kansas. And these outbreaks are largely because of under-vaccinated communities. And approximately 95% of the cases are among people with no vaccine status or unknown status. Vaccination rates are essential to keep communities protected. Let's talk about herd immunity. It's a powerful way we protect each other, especially our most vulnerable, like babies, the elderly, and people with weakened immune systems. Herd immunity happens when enough people in a community are immune to a disease, either through vaccination or past infection. This makes it very hard for the disease to spread, even to those who can't be vaccinated, like infants under 6 months or people with certain medical conditions. So why is herd immunity so important for measles? Well, measles, as we said before, is extremely contagious. It spreads through the air and it can infect 90% of unvaccinated people who are exposed. To stop measles from spreading in a community, about 95% of people need to be immune. That's a very high threshold. This is why even a small drop in vaccination rates in a school, neighborhood, or community can lead to an outbreak. So the virus is just one plane ride away. If you're not immune, you can catch it easily while traveling and bring it back home, potentially spreading it to infants, pregnant women, or people with cancer who can't be vaccinated. So let's get to the most important question. Who needs the measles vaccine before travel? Let's break it down by age. Infants 6 to 11 months. The routine vaccine is given at the 12-month visit, but if you're traveling internationally or going to an outbreak area within the country, you should get one early dose for protection. This early dose doesn't count towards the regular vaccine schedule, but it's crucial for travel. So again, if you're 6 to 11 months of age, you can get the measles vaccine early prior to international or high-risk travel. Children 12 months and up need 2 doses of the MMR vaccine at age 1 and age 4 years. But again, if you're traveling to a high-risk area, we can give that second dose early, at least 28 days after the first dose. And this does count towards your final second dose. Teens and adults, anyone born after 1957 who has not had 2 documented doses or lab-confirmed immunity should get vaccinated. Many adults assume they're protected, but they may be surprised to learn their immunity isn't complete. So I recommend checking your vaccine records. So when should you get the vaccine before a trip? Ideally, try to get the vaccine at least 1 month before travel so your body has time to build immunity or protection. And many physicians or travel specialists can do travel consultations to check your entire vaccine status, not just for measles, but also for other things like yellow fever, typhoid, hepatitis A vaccine, and other routine vaccines. And what do you do if you're not sure if you're immune or not? So if you're not sure if you're immune to measles, we can check your vaccine record or do a simple blood test to check for immunity. And in some cases, sometimes it's faster and safer just to get the vaccine. And it's fine if you've had it before. Is the measles vaccine safe? Yes, yes, yes. The vaccine has been around for over 50 years. It's very safe and effective. It offers protection against measles, mumps, and rubella. Most people have no side effects. A few may have mild fever or rash, but serious reactions are extremely rare. And there is no scientific evidence of any connection to autism. So can a baby less than 6 months old get the measles vaccine? No, they are too young. You have to be at least 6 months of age to get the measles vaccine, as we talked about before. So should I travel with my infant less than 6 months of age? So babies less than 6 months may have some protection from their mom and some immunity that comes through the placenta. But in terms of traveling, I would definitely avoid or postpone travel to high-risk areas experiencing outbreaks. And if you're going to a non-outbreak area, you'd want to monitor the local health department and use to see if there's any measles outbreaks. But it is, a risk-benefit analysis. What if I have a trip scheduled for a measles outbreak area? Get vaccinated early, at least 2 to 4 weeks before travel if you can, if you're eligible. Consider delaying travel for infants under 6 months, as we talked about. Avoid places where outbreaks are concentrated, such as specific counties, schools, or events. And follow basic prevention, such as washing hands, avoid crowded places, and wear a mask in indoor public spaces if concerned about exposure. But if you're not vaccinated, do not go. Can I combine the MMR vaccine with other travel vaccines? Absolutely. It's often given at the same time as other vaccines like hepatitis A or typhoid. Is one dose enough? So one dose provides about 93% protection. 2 doses brings that up to 97 to 99%. So wherever you're headed, whether it's visiting family abroad or taking a trip of a lifetime or going to Texas, measles doesn't need to be a part of the journey. Let's keep your travels safe and your family healthy. And if you're planning a trip, reach out to your pediatrician or internist or travel clinic early to make sure you're protected. And if you found this information helpful, please subscribe, hit like, leave us a comment on our YouTube page for Park Pediatrics and Park Travel Clinic today. Thanks so much, safe travels, and don't forget your vaccines.